Health Minister Ampareen Lyngdoh, on 22nd August, informed that the East Khasi Hills district has more PHCs than what is recommended by Indian standards. Lyngdoh was replying to query on shortage of PHCs in the district, wherein she informed that there is shortage of health centers or dispensaries, which are smaller versions of PHCs.
More PHCs than recommended by Indian standards. And in fact, we are short by health centers. Health centers are like dispensaries. They are like smaller versions of a PHC. And of course, the biggest version is the CHC, and then now we are also instituting what we call them the subdivisional hospitals. These are all the tertiary care centers of the state. How do you connect? A pregnant woman all the way from Ranikor ideally should not come all the way to Shillong for a medical treatment that is vital for safe birth of the mother. So now we are looking at Moklang being one of the FRUs for pregnant mothers. And we will have these kind of facilities. We will have a web of facilities so that we reduce the intake and the wastage of funds by citizens. If we can get there and convince a citizen of a certain region to remain within that region to get all the help they want, then I think we would have walked that extra mile that is so needed in the health system in the state of Meghalaya. This is something which I have learned in my journey throughout all the districts. And this is something which I know needs to get done. Whether it will get done in a big way, whether or not we will be able to fill in all these gaps is something to be seen. But we need to have a plan. You cannot go blindly across 5 years without reviewing what you need to do. So, health centers now are going to be managed by communities. That is a unique feature, unique character of the state of Meghalaya. We have seen during crisis times like the COVID that it is the health, it is the community leaders that actually contained health hazards for the people of the state of Meghalaya. So we will utilize these systems which are inherently there in the state, and we will allow community leaders to also help in ensuring that quality health is given to citizens of the state of Meghalaya. For example, why is the MMR and IMR rate so high in the state of Meghalaya? First thing is that hesitancy for institutional deliveries. But I'm very sure that if our community leaders can help us with these local DIEs, as we call them, these local birth providers, I think we will be able to do much better. I wish we would have centers in every 10 to 25 villages, where at least if a mother is hesitant to come for whatever cultural belief, social belief, mental peace of mind, at least mother should have a safe place for the child. And if we can have babies protected, many of our newborns are succumbing to issues which are related to birth. A child is born, child is not resuscitated on time, child develops a big pneumonia, from what I understand as a layman. Now this is something which should not have happened. We have delayed deliveries because of complicated pregnancies, high-risk pregnancies. Now these mothers don't even know the risk they put themselves at, the risk they put their children at. So with the ASHAs and the different workers of the health department, if we can have a convergence. Right now everybody is doing things differently. So we need to converge. And MLAs are the key in all of this convergence plan.
How many such hospitals are